Ways Kinect can be used in healthcare.
So I and along with him interviewed a person from Kaiser, and he told us like a lot of things of how Kinect and patients interact and move and how it works.
So when using Kinect for physical therapy or autism patients, the people like it more than just normal therapy because it has a fun factor to it, and there's no controller, you don't have another person talking to you, it's kind of just your own immersive experience.
And so a lot of doctors are like inspired to use it, and kind of this whole project is mostly moving to improve and how it can this system can evolve and kind of show progress. And a lot of the doctors at Kaiser are like totally like seeing a future, and so there's a lot of things that
What one doctor did is this hospital programmed an application for Kinect since the Kinect source development kit is available to the public, which is a good thing, so anyone can make applications for it. He actually made a program that would take his patient's files, so while he was in an operation operating on a patient, instead of having to sanitize, go on the computer, look through the patient's files, see what he needs, re-sanitize, and go back, he can just look up and scroll through the patient's files with Kinect, so he doesn't have to go through all the sanitation, and it makes the operation much quicker and better for the doctor.
So they're working on making Kinect kind of an easier. It's kind of it's a very broad whole system, and it needs to be easy to use, so that different patients with different needs can use it in different ways. And there's a lot of factors to this. So parking, driving, Kinect in bed to make your chair up and down and just stuff like that.
So while a patient is in bed in a hospital, while Kinect can be watching them, for example, they're an old senior patient and they fall out of bed, Kinect can see that and send a little message to a nurse saying, Johnny D fell out of the bed. Or they can wave their hand and say, nurse, and a nurse will be called because Kinect has great voice recognition software. Also, if they can't use their voice, something's wrong with their throat, they can always use a gesture, and if they can't gesture, they can always talk.
So, so statements that patients need Kinect to benefit physically and verbally, and a lot of just moving around. And so elders can need voice benefit to speak, and it can also just be like a social thing, just talking. So yeah, it's like.
Also, while in the hospital, if elders are feeling lonely, or any patient for that matter, there could be a voice or video chat feature built in so that patients could communicate with other patients with their same disease, diagnosis, so on, or just talk about that, or even if they don't have the same diagnosis or condition, they can still talk about their stories and not feel so lonely in the hospital room. Also, it can Skype. Kinect has a feature where it can Skype with people, so instead of visitors coming to the hospital, crowding the hallways, and having to do all that registration, you can just Skype. Skype is on computers, phones, anything. Just Skype the person at home, and the person in bed will feel more secure because they can talk for as long as they want on Skype. Instead of having a limited visitor time, the person doesn't have to drive all the way there, have to go through all that process, and it's just a much easier process overall.
So that's the system itself, and I think what the doctors and people using this are trying to do is kind of take what they need, like the code or program that they want from it, take it, modify it, and make it something more. So there's a lot of things that you can do with that. There's voice, physical, and they take it and they modify it and they use it so patients can use it and they benefit with what they need. So there's how might we get someone to use Kinect, because a lot of people are like worried, like they don't trust it, like a lot of people who, like the elders, they're in the last generation and they haven't, I don't know, come to
elders aren't very comfortable with all that digital and they're not very familiar with the computer interface, Kinect doesn't have to use any mice, any keyboards, any learning. It's very intuitive in that sense. So it will just at the beginning show you the commands, nurse, help, water, that kind of stuff, and then you can just speak those commands and you don't have to go through all the fuss and fuss of going through that. Also for children, Kinect makes it so that kids also have a fun factor while they're in bed, so they're not just sitting there with nothing to do.
So we went into this idea of improving. So here are a list of ideas on improving it. So ideas number one is more voice commands, because already they have connect, play game, and stuff like that for gamers. But so if you have more voice commands, also swifter movement, more anchors, because how Kinect works, I think, is that has anchors in your palm here, and kneecaps and feet, and it kind of magnets those anchors and sees where they are. And then if you have more anchors in different places, then it can be swifter movement.
Like if you have, for example, right now Kinect, like Austin said, it uses anchors, so it first scans you and it sees, oh yeah, here's his arm, here's his leg, here's his chest, and here's his head. So it doesn't actually look at the individual fingers or the mouth or, for example, eyes. So if there was more anchors, you could hold up 2 fingers or 3 fingers or something to indicate other commands. Kinect, as we said, voice chat from patients to nurse or from patient to patient, and gestures mean help or assistance, like if you're choking, you could do this. If you need water, you could do this or something.
Using Kinect to maneuver a wheelchair, it's not exactly it hasn't been done yet, but it's just an idea of, patients who can't walk or something, and they need to get around. So I don't know how this would work, but maybe voice, you could say move forward or something. But it's just kind of, a seed beginning to grow in that branch area. Motivation to use it, like rewards, like you beat a level and you get a new level, and all the doctors want from that is just, as long as you're doing something physical, then it works. So just as long as there's a next step in the game, they'll keep moving forward, and then while they're doing that, they can just progress and make new levels.
So the Kinect application and program has a camera on computer iPhones. So basically, instead of having Kinect be hooked up to an Xbox 360, meaning everyone has to get an Xbox 360, or having it, now they have Kinect for Windows. So you can hook up your Kinect device to your Windows computer and use Kinect that way. But it would be much easier if it was just built into the TV or built into your iPhone mobile device. So instead of having to purchase an Xbox Kinect that's not very portable, you could use something like your iPhone and just wave or do the Kinect gestures and voice commands like Siri has, and just use it from a more mobile standpoint.
So we went more into idea number 4, which is the video chat. And so basically, again, the idea is just communication from the patient to the nurse. And if you want to go more, then it can be from patient to patient, just to get a social life, because it can be very lonely in your home, and if you can't get out, then you can't meet a lot of people. So maybe you could make different words mean different things. So you can make help mean assistance, or assistance meaning you need help, or you can say some code word like pie or something, and then it will know, and you can change the word.
So as we said before, you can chat with family through Kinect, you can chat with friends through Kinect, so you can actually video conference with Kinect, so you can see multiple people at once on the same screen, kind of like a hangout. And also, doctors can look at Kinect's hangouts or conferences and see how patients react to different questions and movements, because it can look at your face because it's recording you, and it kind of has this little avatar that represents you. So if they see someone bring up back pain and that patient hasn't really talked about back pain before, and they're just more openly expressing it to other patients, they could ask them about back pain, or if someone brings up some subject and one patient recoils, like from some sort of diagnosis, then they can see, oh, he reacted this way to so-and-so's question, meaning blah.
So it's so new. Like even doctors and idea specialists or whatever, they don't know exactly where this is gonna go, because it can go in so many different ways, and it's such a positive, it's such a positive idea and can be used to such good uses. Like again, you can like call a doctor for like a check-in without having to like use the Kinect system itself. Like again, to the mobile, if you want, you can just put it in your mobile, like, and then an app that would take a lot of space, but I don't know. And then you can just call like for a check-in, and then the doctor will come and know that's not like needing immediate help. So yeah, I guess that's kind of it.
So thank you for watching our presentation about Kinect in healthcare. And I hope you learned something new about how different products, even if they're not directly related to healthcare, can be used in a positive effect for other purposes. Thank you.
Bravo.